A.McGlynn. This is Assess 404. Today is the 19th of February, and we are doing a skills assessment on HLTH PS008. I have Lisa Colin-Brander, who is our mentor, and our mentee is Jenna McKenzie. Hey Lisa, how are you today?
Yeah, I'm good, thank you. How are you?
I'm really good. Are you ready to sit your assessment today?
Yes.
Now, you've got that mild hearing. We've tried to eliminate.
Yes, we've got a nice quiet room in here and there's no external noise that's going to interrupt, so
Okay.
I should be fine.
And if you have any problems, you just let me know.
Definitely.
Okay?
Definitely.
Right. So, as a mentor, you're going to go through the action plan that you wrote earlier with Jenna.
Yep.
And select one of the skills or the goals that she'd like to achieve, and you're going to mentor her in that.
Beautiful.
Okay. So when you're ready to start, we'll start.
Alrighty. Okay, Jenna, thanks for coming in. As we did talk the other day regarding what you would like to next move on to and achieve during your TPP year, one of the things that you did discuss was you wanted to commence your cannulation package. Now, I believe that we've given you this package. Yep. Have you had a look through it?
Yep, I have. Yep.
Okay, so this will have to be completed before you can actually be signed off and undertake your assessment, your formal assessment.
Yep.
So did you have any questions about these at all? You knew that there was a lot of reading in one of them, there were some questions in the other.
Yep.
And some other resource materials, so you're happy to keep working on those.
Yep.
Sorry. You know that if you do have any trouble with anything, come and find me.
Yep.
I'm here most days, and I'm more than happy. This room that we've set up so that you can actually come in here and have a play with some of the mannequins, including the arm that we've got here. Just to build your confidence so that you're feeling more at ease with all the techniques and all those sorts of things. So I thought today we could just have a quick chat about, why we actually do a cannulation. It's really important. It is an invasive procedure, so it's important that we don't undertake it willy-nilly. You know, we've got to have a clinical reason there to perform it. And we've also got to have the patient or client's consent. So can you just tell me what would be some of the reasons that we would need to, that you could think of now that we would need to actually pop a cannula in somebody?
Fluids, if the patient wasn't able to have them orally.
Yeah, definitely.
If they need antibiotics, blood products.
Yeah. So it's a really long list and it's not exhaustive. Sorry. Sorry about that. I should have turned that off. So it's not an exhaustive list. There's lots and lots of things, but we need to make sure that we actually are ticking those boxes, and we really do need to do these invasive procedures. It's just not going to make our life easier if we do them. So you did say to me that one of the things you're a little bit not sure of was all our bits and pieces that we use for a cannulation. So I've put together some things here, and I thought what we could do is probably go through and just talk about the procedure itself, what we use, how the aseptic technique that we use, and some of the things that can go wrong, and how we would troubleshoot what we need to. Okay. So what we need to do, first off, as we said, we're going to get consent from our client, discuss why we need to put that cannula in, and make sure that they've got a true understanding. Just putting their arm out is not a consent these days. We actually need them to be able to, confirm that they understand what we're talking about. So when we start, we have a really good look at the person's arm, and we decide, we always start from down here and we work our way up. When we're doing a cannulation, we leave our big veins up here to the very last resort. If we need real big quick access, we can jump in up here, but otherwise we would go down here and work our way up. So when we're looking at a patient, you know that we've got our tourniquet. So we need to actually pop that on at the distal end of where we're actually going to be inserting. And it's got to be quite firm, because it does have to have some restrictive component so that it does make our veins stick out a little bit. Can get the patient to just open and close, clamp their hands down. Now you can also, if you had a frail old person, they can have little veins, which can be quite difficult. So we can get a nice warm compact. You would release the tourniquet. You don't want it to be tight for too long. If you're going away to do anything, make sure you always release the tourniquet. The other thing is that warm compact. If we were having a bit of trouble, we'd release that, pop a warm compact on there. Just say, look, make sure you leave them in a nice comfortable position, and we'll be back. And we'll go further after we've let those veins warm up a little bit. So we've worked out our landmarks here where we might like to. Can you see that we've got in your package, it's going to highlight all the main veins that are there. It's really important that you know where they are, their names, and where they run, so that you're able to easily know that if we're going in here, what area we're going into. It's not going to be a little short spindly vein. So we're going to have a good look here. Of course, always wash our hands before we come near the patient. Just have a little look, try and identify our landmark. Okay, so we're going to release that for a minute, and we're going to prepare our area.
And how do you know like what size to use?
Okay,
for this
so that's a really good question. So depending on why we're actually cannulating the patient and what we're needing to do. So if you had a person that was septic, very, very unwell, and needed large volumes of fluid, we need a very large bore cannula. Little cannulas just won't cope with the amount that's going in. If we had a geriatric patient that was just needed to have some continuous slow fluids, we could use a smaller cannula. Now, knowing that the sizes of cannulas are back to front to our numbers. So the lower the number, the bigger the cannula, the higher the number, the smaller they are. So now it's an aseptic technique. Do you know why that would be?
Because you're punching the skin, so you're
there's a risk of infection
a risk of
there.
infection because you're going to pierce it in the skin.
Yes, definitely. So we've got, you'll really get used to everything you need, and it'll just be second nature to you. So like you would, you try not to, you want a nice clean surface to open all your things up on so that they're easily accessible. Now I've got some things down here. Can you think of one thing that we're missing that we might like to use?
Oh, like a trolley?
We could use a trolley, we could use a trolley, or and the other thing is we may need something to put our sharps into, so I've actually forgot a sharps container. That's okay. Okay. So we just have to make sure that we've got all our bits and bobs out and about. not a sterile field, it's just an aseptic technique to reduce any risk of infection.
Yep.
Now, this being our 24 gauge and this being our 20, so the 24 is the smaller. As you can see, if you have a little look at the needle itself, it's a lot finer than this 20. Yeah. So 20 and 18 are generally the sizes we use. In maternity, we sometimes put a 16 in because they can sometimes need some really big fluid resusces. Yes, yeah, definitely. So I've got my little bag over here as well, which is
rubbish bag. Yeah.
Yes. Okay. So it can be a little bit messy when we're doing this, so we need to prepare our environment as well. Especially if we've got a patient that is not very mobile.
Yep.
We need to ensure that we're not going to cause them any extra stress by having to change sheets and do all those sorts of things. So we've got this down here. One of the things that we need, of course, is our Tegaderm.
Yep.
We're going to secure it with some steri strips and then cover it with the Tegaderm.
Yep.
So in this pack comes our antiseptic wipe that we usually use. Okay, so going through your, have you read through the package at all yet?
Yes, I have read through some of them.
Okay, so you talk with me and just let's see. All right, so where might we go? What do you think might be a good one?
One of these two.
Yeah, so this one here is lovely and straight, and there's we can't see any valves. Now valves can cause a little bit of problem sometimes when you're feeding your needle in, so it's really important that you look for that nice straight vein if you can. If you feel up here, have a little feel up there.
Yep. Can the cannula move, like say once you are trying to insert it, can it like puncture or?
Yeah, definitely. So if that happens,
if it had like what you were saying before,
Yep.
like the grooves or whatever, would that be more likely to happen?
your little valve.
Yeah.
Now you'll just have a lot of trouble trying to feed it through.
Okay.
You'll get a nice flashback which tells you you're in the vein, and then when you try and advance the needle, the actual cannula, it won't go through.
Yep.
So what we look for is this, always have a feel. It's not about what you can visually see, it's about what you can feel. So it's all about feeling.
Okay.
Now, it's important that we protect ourselves and we wear our gloves when we're doing this technique.
Yep.
But prior to it, just make sure that you've had a really good feel and you know exactly where you're going.
Yep.
One of the tricks that I try and use, if I find a nice nice vein that I like, that may not be as visual, but is really, you know that it's there, is I get one of my little spare Alco wipes and I put it as a triangle just on the edge there, so that you know where your guidance is. So I'm going to clean my hands. Now, really important that you have a good clean, that you've got short nails, all those sorts of things. Nothing that's going to cause any problem. And I'll just grab those gloves if I can, please.
Yep, no problems at all.
Thank you. Where's my timer? So many years ago, these weren't something that we would always use. They weren't when we cannulated, but you know, really important that we keep ourselves safe as well as keeping the patient safe. Okay. So we've protected ourselves, we're nice and clean, we've had a look here, we've identified what vein we would like to use.
Yep.
So now we've got to make sure that the site is really, really clean.
Yep.
So now by putting a little bit of pressure here, you're actually anchoring that vein so it's not going to roll or turn around.
Yep.
And the best way to do is to give it a really firm clean like that.
Yep.
Like your technique there, Jack.
Thank you.
That's a good
Okay.
little tip, that with the-
This is a really good one. It's really saved me a couple of times. As you get old, your eyes get a bit weakened. But you can feel really good. You can always feel.
Yeah.
Okay, so we've got that nice and clean. We've decided that we're going to use a 20 gauge.
Yep.
Because we need to give some decent fluid.
Yep.
We've prepared.
Oh,
Now, it's important that we do tell our patient that this, it's a needle. It's going to hurt only for a short time. As soon as it's in and we secure it, everything should be good.
Yep.
So one of the most important things to do when you're inserting a cannula is to ensure that the bevel is faced up.
okay.
Okay, if we've got it down, it can cause some damage. It won't flow as well.
Yep.
So we really need to go in there.
Yep.
So what we need to do is anchor, as I said, anchor our vein, making sure that we're really safe with our technique.
Yep.
And we're going to just go in until we feel that we're through. And you'll really get the feel of this when you've practiced.
Yep.
And then we advance. Nice and slowly. There we go. Okay.
Yep.
Now these cannulas here have a safety on them, so once I pull it out, I'm not going to get a huge loss of blood.
Yep.
Because there's a valve in there.
Okay.
So I'm able to attach. I'm going to get my sharps container.
If you like to sit it there, that'll be fine.
Okay, we'll pop it there.
Thank you, Lisa.
And then we pop a little bit of pressure there to stop any sort of blood flow back.
Yep.
And then we can see there. The most important thing to do before we release or do anything is make sure that we can flush.
Okay, yep.
So,
Then if it didn't flush at all, would you just remove it?
so that's some of the things we're going to have a chat about. So once you've done that, release that
Okay.
tourniquet, and we need to secure this device. Now, if we didn't have any success, we would
Yep.
usually know before we actually try and do a
Okay.
flush.
Yep.
Would have trouble advancing
Yeah,
it all the
yeah,
way
yeah,
in. The other thing is, if we've gone through the vein, we're going to see a bleb
Okay.
appear.
Yep.
Some immediate bruising can sometimes happen
Yep.
as well because it bleeds outside
Yep.
the vein. And you just know that you've popped it in.
Yeah.
Oh my goodness,
Yep.
I've blown that vein.
Yep.
So,
So you wouldn't be able to advance at all if it was. in
no,
the-
you're really going to have to put a
Yeah,
lot of pressure
yeah,
on. You've
yeah.
seen there how easy it
Yeah,
was
yeah.
to actually, once you got it in, and you can feel it, you
Yeah.
really can. When you get inside the vein, you can just feel it come and then it advances
Yep.
along really easily. So it's really important that we keep that sight nice and easily visualised to the eye, because
Yep.
that's what we're looking at
Yep.
when we're actually checking. And then we secure by putting our Tegaderm. Once again, this is clear,
Yep.
so that we can ensure that we can see
The side. Yep.
the puncture side. How does that feel? Always check
Yep.
with your patient that they're feeling okay, that it's not
Yep.
painful, and they'll be able to tell you if it feels, once that's in and the needle's gone away and the plastic cannula is in there, it feels funny sometimes, but it shouldn't be painful
Yep.
at all. And especially when we flush it, they'll get a cold sensation because the saline that we're flushing it with is just cool, and they'll just feel it, but it shouldn't be painful.
Shouldn't hurt. Yep.
Really important that we write the date. So do you know how long cannulas can stay in for?
I thought it was only 72 hours, but has that changed?
Well, it is generally 72 hours is the rule of thumb.
Yeah.
But what they say is if we've got a patient that's very, very difficult to cannulate, a chemo patient, somebody like that, has had lots of procedures done and their veins aren't as good
Yep.
or long-standing, it's better to leave them in as long as there's no signs of infection and they're working well than to traumatise the patient by moving them all
Yeah.
the time. Because once we remove that, there's no guarantee we're going to find another
Yeah,
one.
that's right.
Now the really important thing is if we were unsuccessful here, we could have another go somewhere else if we felt confident.
Not in the same vein though.
No, well, you can go up a little bit further if you want. I probably
yeah,
wouldn't
yeah.
come down further. Remember, if we remove
Yeah.
this, we're going to put a dot on there.
Yeah.
And we're still going to pop that tourniquet on, which is going to force
Yeah.
that pressure, which may actually lead to a little bit of bleeding at that site.
Yep.
I've actually checked somebody that needed to have a cannula in, and because I couldn't confidently, it wasn't confident that I'd be able to get it. I called somebody
Yeah.
more senior, being the doctor, the num, maybe somebody from theatre. They're more than happy to come down if we're having a little bit of trouble. You know if you're going to get it. Sometimes you miss. It's unfortunate.
Yeah.
Reassure the patient. Apologise, of course. It wasn't meant to be like this. We're
Yeah.
really sorry.
Yeah.
And it's okay to say, do you know what? I'm not really happy about your veins today. I'm just going to go and get the doctor from ED who does this with his eyes closed.
Yeah.
And will be a lot more successful. They'll be a lot more happier
Yeah, for sure.
that you were able to admit that, other than sticking them with needles all the time.
Yeah.
Yeah. So tell me, when we've completed this, you need to enter it on EMR, on iView, that there's been a cannula gone in, the size of the cannula, all those sorts of things. Now we've also got to ensure that we check that site. Tell me what you would be looking for.
Any signs of redness or swelling around
Yeah.
the site. If the patient was having any antibiotics or anything through it, to make sure that site doesn't hurt when it's going
Yeah,
through.
definitely.
Just documenting the site, and if there's any signs of infection.
Yeah. And if you try...
And the date that it was inserted as well. Yeah.
Perfect. So if we tried to flush that now, so it's been there, we're just going to use it. We're just going to use some more saline. Of course, we would have drawn up another saline. It's really important that that bung has a really good clean right around. You don't know what that patient's been doing.
With just another topic.
Yep.
When a patient has a shower and stuff, I always like to put like some sort of plastic or something over the top so it doesn't get all wet. But some people don't like to. What do you do there? Like when they have
As long as you just have to see that's still flowing absolutely beautiful. If we had any resistance there, we would be thinking, when was it last used? Sometimes they can get a little blood clot just there, and you need to be able to disperse that blood clot. And it'll work beautifully. So to answer your question, you have to be able to keep that site safe. So if you, it's a closed circuit area here, so there should be no area there for infection. As you know, if the patient gets really sweaty or it gets really wet, that dressing will lift. Once that dressing's gone, that insertion site right there is open for any sort of bacteria to enter. So if you feel better to cover it, perfect. You go right ahead. Some people might just be really mindful. They've worked with these for many, many years and they just know that they're there, so they're going to say to the patient, I want you to leave that at home and really remember that it's there. Once you're out of the shower, it's important to get a little bit of tubey grip, ensuring that it's never too tight. You cut a little bit of a hole in it for the thumb, and it just gives a little bit of extra protection there. The patient's not going to bump it, knock it. Yeah, definitely. Now I know that was a very quick introduction, but is there anything, what would you like to discuss?
I think I sort of just asked the questions as I went. Just the thing probably for me is just choosing the correct size for the patient. Probably the biggest.
Okay, and I'm sure when you first start, you're not going to go for the really big one. I don't know whether you had a look at the garden hose that's a size 14. It's quite daunting to even look at it, let alone put it in. But if you were, you would want one of these nice big veins here. Really nice big vein. And as I said, in an emergency situation, if you've got, if you're not seeing that here, we're down in ED, you might be on circulation and they want, or drugs and they want that cannula, go the big ones here. This is going to be a faster way to disperse. So really important with that.
Yep.
25. Do you want to have a quick?
Yeah. Would you like to have a try?
Yeah.
I think it's
sure.
important that
Yeah,
you do have a little bit of a play. So I'll just, we might leave that one in so that you can, no, actually it might get in the road. So we'll just quickly talk about removing them.
Yep, cool.
Always,
Any sharps?
well there's no, so there's no sharp in here now. That's just the soft cannula that's remaining. The most important thing here is that we check the MAR to ensure that we don't have anything else left that we've got to put through this cannula prior to our patient either going home or ceasing IV therapy. So it's really important that you hold that pretty firm there. And this tegaderm is like any other tegaderm. It's not aggressive to the skin and it comes up quite easy. You can pull to the side and it'll release. The only time it is a little bit painful is if you've got a real hairy man and you put it on the other side and you're removing it, you're giving them a free wax job, which they sometimes don't appreciate. Okay, so we're ensuring that we're not dislodging while we're removing the adhesive. Okay, and just as your little, as you remove it, you just apply a little bit of pressure. As you can see here, that's just a real plastic.
I meant the other.
Oh yes, definitely. And that's important that you tell the patients. They always go, oh, I know that there's a needle in my arm. You can say, well, actually, it's a little bit of plastic now, so that's really good. If you need to apply a dot, if you don't and the area is not bleeding, you can pop a little bit of tape over there. But as you can see, that's not actually leaking any fluid. Alrighty. So we might prepare to do another one. What do you think?
Okay.
All right, that sounds great. I'm going to just move some of my mess away and I will pop out all the things you may need. I don't know whether we'll need to use that again. Now to save on some of our equipment, we might leave the bases of all this down if that's okay.
Right.
Now we've just moved through our room.
What would you like?
I'm just looking for another little saline.
Should we just use this one?
Yeah, we probably
The rest I
can.
can just.
It'd just be nice if you got the full. Yeah, that's okay. We'll just. It's only a practice. You're not being assessed on this. Just really so you can get a bit of a feel for it.
Yep.
Okay. All right, so I'd like you to really talk with me.
So, the patient is requiring a cannula for antibiotics.
Okay. Yep.
So I would explain the procedure and obviously get the patient's consent.
Yep.
And then I would make them comfortable in a chair, pillow if needed, and then grab all my things, everything that I need, everything that I might need.
Yep.
On a trolley or the cannula trolley as we have, and bring it back to the room, and have a look at the arm. So,
Definitely.
So working from the bottom up.
Yep, so you can even have a look on the underside if we've got somebody. They're a little bit more tricky and sometimes a little bit smaller.
Yep. And then working my way up so they can see these two veins here. What did you use before? Did you just use a little white to
Yeah. So I just open one white and just put it on an angled diamond.
So maybe this one, we could try this one?
Yeah, why not? Now remember, you're looking to make sure that there's no
That
feels of
looks
any
a little bit
lumpy or...
That does feel a little bit lumpy.
Yeah, so you might actually have a little bit of damage there from previous. Yeah, or you might have a little knobble or a valve.
So this side probably would
Yeah.
be best.
Yeah.
If not, probably up here.
Definitely.
Should we try there?
Yeah, why not?
So just giving it a
Really
clean
good
and
clean.
would I put this on now?
Well, yeah, pop that on.
Yep.
Just knowing that you're going to tighten it up so it's nice and firm.
That's probably the best
Now
one.
remember, instead of just visualising, you want to be able to feel it really well.
So I don't feel any bumps there or
That's
anything like
perfect.
that.
And you can feel that it's a straight line, it's not going to go off to the side somewhere.
Yep.
Yep.
So in this, would I be sort of aiming for more here?
Yeah, you want
or-
more of a straight surface. Now I know that we do have, as long as the
Once it's
needle
in,
has a part to go in,
Yeah.
and it's just the plastic that's going around, you might be okay, but you're really putting yourself up against a little bit of resistance if you're going to hit a corner.
Okay. All right. So do you think maybe down here?
Yeah, I think this would
Probably
be your
the
best bet here. That would be
So
definitely
sort of
my
what you
first
did
choice.
before.
Yeah.
So with the line and everything.
Mhm.
So then I would get my equipment, set it up on a trolley, decide what size cannula I'd be
Mhm.
using, then perform hand hygiene,
Yep.
and just do that, and then gloves.
Yep.
Because I felt the site without gloves on, so.
And that's
good.
okay.
Yep.
That's okay. Yep. So now you're doing your hand hygiene.
Yep. And then
Give
I
yourself some
will
gloves.
pop some gloves on, yeah. And after I've got the needle in, I'll take this off, right?
Well, no, if we were just having a little look around, we might have released that a little bit sooner,
Okay.
and then we'll tighten it back up when our hole.
All right.
we're
So
all-
maybe just take
Yeah,
this off.
yeah,
Give them a little
definitely.
break.
Yep.
And then open all these bits and pieces up onto the field. In the rubbish bin. And that was prepped earlier.
Yep.
And then do you maybe tighten this back
Yeah.
up? And so I haven't used one of these before.
Okay.
So
So if I've touched that with my finger, I would probably open another pad and give it a good clean. Or you feel like if you feel like
Oh,
you've given it a really good clean, that's okay.
maybe just once more.
Yeah.
Did you go round in a circle? What did you do?
Yeah, I
What was
think
your-
if we just use that circular motion,
Yep.
that's perfect.
Okay. Now, do you dry it after? You don't. you
No,
just leave
no.
leave it?
Remember, it's alcohol wipe, so it'll
Yeah,
air
yeah.
dry fairly quickly.
Okay, so
Now these ones are slightly different.
it's a bit small. This one.
So see this button that you have here, your bevel will be on that side where that button is.
Oh, okay. Yeah.
So when you actually go in to the area,
Yep.
you can advance in, and once you push that button, it retracts the needle into the base.
Okay.
So it's a real safety
Let's get rid of that.
cannula.
So leave this on.
Yep. So remember, you want to try and anchor that. You've got to remember you're not going to put yourself at risk. You want
Yeah.
to try and anchor that vein. If it's an older person, their veins, even though they might be nice and big and juicy to feel, they can sometimes roll.
Okay.
So you'll think you're going in and it's going to roll to the side. So if you use a finger here to say anchor
Okay.
down,
Yeah.
that's it, that's perfect.
So the beveled edge
Is up.
up.
Yep,
Is it? Can't see it in the
Where's your
Oh, yeah.
bevel?
Yeah.
yep,
There it is.
perfect. Okay, so you're just going to go down. So straight down, and then you'll feel.
Oh, yeah.
Did you feel
Yeah, I
that?
felt it, yeah.
Okay, perfect. So you can. Yep.
Now press this down.
Yep. That's it. And
Okay.
see that? That's all encased. Then we don't have a problem about a sharps.
Yeah.
Mm.
Okay.
so you need to pull your little plastic off there. So if you pop a little bit of pressure here on this vein here,
Oh,
it'll
okay,
stop
it pops
any
up, and it
leakage.
sort of pops up.
And that's, you've got to pull that little
Oh,
plastic
yep,
off.
yep, yep.
And the good thing is you can see that you've got that return there, so that you know that you're in the vein. If you
Yep.
didn't have that return on one of these cannulas, you'd be thinking to yourself, oh, maybe I haven't actually got it inside the vein.
Yep, so then that's fine there, and then I would need a dressing.
Yeah, so we're going to flush it first,
Oh,
remember, to ensure that it's working well. That's a great technique.
Oh, it's actually not really flushing.
Okay, alright, so what about if we pull it, yeah, just to pull it
Oh,
out a little
sorry,
bit.
yep,
There
yep,
you
there we
go. We might have had a little bit of
Yep, might have
pressure
bumped it.
leaning
Yep.
down, so that's perfect.
Okay. Do you do a full 10 ml flush usually, or just?
Yes, you should.
Yep.
You should.
Okay. So that's okay.
Right.
So I'll put a dressing pack on now.
Yeah, definitely. So we're going to release our
Oh
tourniquet.
yeah, sorry.
Definitely.
Sorry, friend.
Okay.
We don't have another Tegaderm, do we?
No,
That's okay.
But that's just a really good way to have a.
Yeah, a little play.
Yeah, definitely. How did that feel?
Yeah, it was. I definitely felt it go into the vein, so that was.
Oh, very good.
That was good.
Okay, so if you were to remove it, you just grab. If that was a nice clean piece, if we were taking this cannula out now because we didn't need any further IV.
I would just take the
Dressing off, yeah. You're going to have your little bit of your Alco White there to hold over the area, or a Band-Aid dot, whatever you've got.
And then just
Yeah.
pull it out and put a little bit on. Yep.
And that's it.
Okay.
All right, so that felt okay?
Yeah.
Beautiful. So what we'll now talk about, just quickly,
Yep.
when you finish your package, you'll need to have 3 supervised. First of all, you're going to do your package. We'll go through it. I'll mark it.
Yep.
Discuss anything that we need to talk about. We'll sit down together and I'm going to get you to do a cannulation for me, just like you did.
Yep.
Now, to be marked off as fully competent, you actually have to have 3 cannulations that are witnessed by myself or another senior staff member.
Yep.
And they'll actually sign and document that that has occurred.
Very successful.
Yeah,
Yep.
yeah. And once that's happened, then you're good to go. You're good to go.
Right.
But always know that there's support around. If you're feeling a little bit out of depth, or if you think, I really don't want to do this, I'm not feeling confident in popping a cannula in.
Yep.
Do you know what? That's not a negative. That's a positive,
Yep.
I think, in a nurse's ability to say, do you know what? I'm not really up to this at the moment.
Yep.
I'm going to go and get somebody else.
Yep.
So, yeah. But it's important that you expose yourself to as much as you can, because
Yep.
that will improve your skill and your confidence. Yeah.
Great.
And I think you did an absolutely fabulous
Thank
job.
you.
Anything else that you wanted to chat
Not
about?
really. I think it's just the getting the package done in the practice.
Yeah, and remember that
Yep.
this is here to use
Yep.
at any time that you want to, and come and grab me.
Yep. No worries.
All right. Okay. Thank you very much.
Thanks, Jackie. Thanks. What we'll do is I'll get back to you in a couple of hours. You've done great in this assessment. I just have to do your knowledge and stuff, and we'll have a debrief and feedback.
Beautiful.
Okay?
Okay.
I'll talk
Thank
to
you
you
very
soon.
much. Okay.
Thanks, girls.
Thank
Thank
you.
you.